Understanding Medicare doesn't have to be confusing. Here's a simple guide for seniors or anyone helping a loved one. Medicare starts when you turn 65. It has four parts. Part A is hospital insurance. It covers inpatient stays. Part B is medical insurance. Think doctor visits and outpatient care. Together, A and B are called Original Medicare. Then there's Part C, also known as Medicare Advantage. It bundles A, B, and often D into one private plan with extras like dental or vision. Part D covers prescription drugs. Now here's what matters. You're first eligible during a 7-month window, starting 3 months before your 65th birthday. If you miss it, you could face penalties later. So, what should you do? Step 1. Decide between Original Medicare or a Medicare Advantage plan. Step 2. If you pick Original, you'll probably want Part D and maybe a Medigap plan to cover costs. Medicare doesn't. Step 3. Use Medicare.gov to compare plans in your zip code. It's simple and free. The system can feel overwhelming, but once you break it down, it's manageable. Get the coverage that fits your life, not just your age.